fixing his hair.
Yeah. It doesn't count, sadly. It has been said that beauty is in the eye of the beholder. Yet each of us here tonight probably has a different definition of what is beautiful. And I'm sure at times each of us here this evening has looked in the mirror and either questioned or been displeased with a certain part of their physical beauty. Perhaps it's one of those, I look fat in these pants, or oh, I wish I didn't have this pimple on my head, or for the gentleman here, perhaps, oh my gosh, I see a bald spot. But these are merely insecure thoughts that tend to pass with time, and they're just part of our development. My question for you all is, what if these thoughts didn't pass? What if these thoughts manifested in something that was so crippling, so debilitating, you did things like take the mirrors down off your walls, spent thousands of dollars on plastic surgery, or became so overwhelmed by these thoughts you no longer wanted to go or could go into social settings, like joining me here tonight. Sadly, this is a reality for 1 to 2% of the world's population that's affected by body dysmorphic disorder. I ask everyone in this audience tonight, open your minds and your hearts. Allow them to be filled with empathy. Allow your ears to listen while I further explain to you what body dysmorphic disorder is, symptoms, causes, and possible treatment options. What is body dysmorphic disorder, or BDD? Body dysmorphic disorder is a psychiatric illness. According to the Mayo Clinic, it is a chronic mental illness in which one cannot stop thinking about a flaw or defect in their appearance. An intense obsession with one's appearance and body image. This intense obsession involves symptoms of extreme concern and disappropriate imagination for the defect and the actual image. The key word there is an imagined defect. This excessive obsession with the defect and the flaw can be seen with their unhealthy amounts of grooming and their unhealthy amounts of self-examination. The strong belief in one's believed ugliness can be seen in the individual's extreme self-conscious behavior. Such behavior can be refusal to appear in photos, excessive amounts of makeup to hide or camouflage oneself, hair plucking, skin picking, and as I said before, plastic surgery. Some of the most common areas of obsession include the skin, moles, acne, freckles, hair, whether it be facial or body or head, breast size in both men and women, genital size in both men and women, muscular size, overall shape and size, lips and thighs. Body dysmorphic disorder is still undergoing further debate and research to its exact categorization. This is due to the fact that many of its characteristics are considered to be a subtype of other disorders, such as obsessive-compulsive disorder, panic disorder, anxiety disorder, anorexia, and bulimia. The key difference with body dysmorphic disorder is the obsession that relates to one's body and image and how it disrupts one's life. The DSM criteria for body dysmorphic disorder is the following. A preoccupation with an imagined defect in appearance. If a slight physical abnormality is present, the person's concern is extremely excessive. The preoccupation causes clinical significant distress and impairment in occupational, social, and other important areas of functioning. The preoccupation is not better fitted for a different mental disorder. An example would be shape and size and anorexia nervosa. Now, the actual causes of body dysmorphic disorder are unknown, but there are a number of indications that things like sociological, environmental, and biological factors contribute to this mental disorder. BDD, or body dysmorphic disorder, is quite common, but it goes unreported and undiagnosed. This is due to the extreme shame and guilt that is felt by the individual who is suffering. Although this illness will not go away if you don't talk about it, it actually has the potential to get worse and become more debilitating. There are a number of different treatment options, though, for an individual who is suffering from body dysmorphic disorder. One of these is called cognitive behavioral therapy. According to the National Alliance on Mental Illness, cognitive behavioral therapy is a supportive treatment that focuses on the patterns of thinking that are maladaptive in underlying thoughts. Those who are in distress are encouraged to monitor those thoughts that pop into their mind in order to enable them to determine what patterns of biased thinking exist and come up with more adaptive thoughts to those existing. Medication is also effective in treating someone who has a body dysmorphic disorder. Such medications like SSRIs, including Zoloft and Prozac. A carefully constructed combination of cognitive behavioral therapy along with medication that's been designed by a mental health care professional is a recommended treatment. Earlier I asked each of you to open your minds and hearts and allow them to be filled with empathy. I asked if you would allow your ears to listen when I explain to you what body dysmorphic disorder is, symptoms, causes, and treatment options. My intentions and my efforts tonight is not to persuade any of you in this room to thinking or believing you have body dysmorphic disorder. But tonight I wanted to inform you on this real, heartbreaking, debilitating mental illness that so many suffer in silence with.
I have 3 questions.